What are developmental milestones? These are skills that we expect babies and kids to have at various ages. Now, why do we talk about them? We can use them as a gauge for knowing whether a baby or a child's development is on track. Now, I often see one of two things happening. Sometimes I see parents get really stressed about developmental milestones. I see that milestone anxiety is becoming a thing. Now, I don't want this to happen because each child is different. And I know parents receive a lot of stress because the people around them compare kids with each other. The cousin is already doing this. How come your child isn't? And they're almost the same age. And there's a lot of stress and pressure around this. That's why we don't want to compare kids with each other. At the same time, we need to know when a child would already need help with their development. And that's why we don't compare them with other kids around them or with the kids of other moms in a play group or in a Facebook group, but with specific standards that are based on evidence. So, on the other hand, I also see that moms can be worried about their kids' development. And then sometimes people tell them, no, it's okay, we just wait and see. The thing is, if we see that there might be concerns in their development, what we call early intervention actually helps. The earlier that we start helping a child, the better it's going to be for them. So that's why early intervention is important. And then, to add to the confusion, there can be different sets of developmental milestones depending on the source that you look at. The reason is sometimes there are developmental milestones that are based on what half of kids are able to do. There's a newer set of milestones that they came up with that is based on what 75% of kids are able to do. And these are the milestones that I'll be sharing in my videos. So, what's our takeaway from this? If we use the developmental milestones that are based on what a majority or 75% of kids are able to do, that means, for example, we say that a 6-month-old needs to be able to take turns making sounds with you. That means if your 6-month-old isn't doing that yet, it may be time to speak with your pediatrician about it. There's no more room for waiting and seeing. Because with more advanced sets of milestones, then if your baby doesn't do it, we can say, oh, maybe we can wait and see if there's, we used to have these terms called red flag signs and all of that. But now, if they don't meet a milestone, then it may be time to see if further evaluation might be needed. And there's another takeaway also is we do not use these developmental milestones to diagnose. Sometimes I get about this. Oh, there's this milestone that, for example, at this age, a child is supposed to have so and so words, and my child doesn't have that yet. So, does my child have speech delay? Now, we do not make a diagnosis based on these developmental milestones. But when we make a diagnosis as developmental pediatricians in our clinic, we look at a lot of things. In fact, the first step would be to go to your pediatrician and then they're going to do what we call a developmental screening. So they'll look at the milestones, they'll interview you, and then they will also have you answer some questionnaires. And then, if they feel that they need further evaluation, they can refer to us, developmental pediatricians, for further evaluations. And then we use interviews with you, observing your child, and doing some tests. And sometimes we may even need a series of consultations and observations for this. So it's not just as simple as passing a milestone or failing a milestone. I talk about milestones for two reasons. First of all, they can be the first clue that a parent might have that they would need to speak with their pediatrician about a concern. Like, for example, they see that at this age, my baby is supposed to be able to do this according to the developmental milestones, and I don't see this happening. Do we need to do further screening? Do we need to do further evaluation? And second of all, I think in a lot of ways, it also reassures parents Because a lot of people think that in the first 3 years, kids need to be reciting the ABCs, kids need to be learning how to write letters of the alphabet. But if we look at the developmental milestones, these are not mentioned. And these are, as they say, evidence informed milestones. So that means we don't need to worry about ABCs and learning to write in the first 3 years of life because that can come later. So I think that will help us know as parents what we will focus on during this time and what we can get off our plate. And I know that's always good news for us as parents because we already have hundreds of things on our to do lists. And if we can scratch up something that we don't need to worry about right now, that's definitely good news. And as always, of course, if you have any concerns, you speak with your pediatrician or your care provider. This is not meant to replace getting a diagnosis or getting a consultation. It's not meant to replace getting intervention if your child needs it.